Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast. We're here with our usual crew. If you all introduce yourselves right now.
Hi, everybody. My name is Daryl Drebna. I'm the Senior Director of Regulatory Affairs.
Hey, I'm Lauren Lightning, I'm Director of Government Relations.
Jamie Miller, Ambassador Goodwill.
And very importantly, we have a special guest star today, a noted physician, Dartmouth graduate, John Kennedy, Chief Medical Officer for AMGA, as well as President of our foundation, and also the runner of AMGA's Value Roundtable Summit, which is going to be held the day before Capitol Hill Day. And we are thrilled, one, to have you here, and two, to partner with you during our Capitol Hill Day session. Usually we ask a question before we start, but Mike and I said we ran over too much, the last one, so no question. But today we're going to talk about Capitol Hill Day and the Value Summit, and we're going to turn it right to John Kennedy to talk. Yes.
And then we get to ask him about our ailments.
Yeah, exactly. He's an endocrinologist. I just had a bunch of sweets.
Call them on 1-800-AMGA if any questions.
My A1C is about 6.1. All right, Dr. Kennedy.
Well, thank you for having me. As you know, I've been preparing for this for weeks. But very happy to have an opportunity to tell you about our Value Roundtable Summit.
Fantastic.
So should I dive in?
Dive in.
Okay.
We're looking at you.
I mean, there's a lot to talk about.
You're a special guest star.
All right.
And so
You get a tote bag.
Absolutely.
No, we can't afford one.
Okay. I'll get a recycled one. I got NPR 2015 one. I'll give it to you.
Usually it's just a coffee mug, but I'll go with the tote bag. Well, great. So we've got an amazing lineup. So we're starting off with our Acclaim award-winning group, Corewell Health.
Yay.
And they're going to go over how they've learned how to expand and scale high-value care. They have some amazing clinics that they run. We got the tour. Jerry Penso and I got to go up there and tour their clinics.
Wow.
They had some high-risk patients in the geriatric population where they give what we like to call the bear hug response. So you have not just your own primary care doctor that spends extra time with you. You've got a pharmacist in the clinic to go over all of your medications. You've got a social worker, and they address all of these cares. And what they've shown is that they're able to reduce ED utilization and hospital readmissions and save money overall.
That's fantastic. And you notice that Jerry and John get to go to these members because they're physicians, and we stay at DUC.
Yeah.
So not to note the obvious demarcation of prestige, but thank you, John.
Well, yeah, I'm Jerry's physician when he travels, just in case of any emergencies.
You have the briefcase.
You have blood vials and everything ready to go.
Yeah, so after that, we've got Geisinger and Health Partners. They're going to be talking about transitions of care. This is a spot where you can lose a lot of money if you're not managing this well. Patients that are in the hospital, they have to go back to a primary care setting. You want to make sure that they've got all their medications and they've got all their specialty appointments lined up. And you don't want to lose them in the rehab hospital or the skilled nursing facility before they make it back to that primary care. So they've done some great work, again, optimizing value and really improving patient lives with multiple complex chronic conditions.
Oh, that's fantastic.
Yeah.
And you're a Geisinger alum, aren't you?
I am, yeah. So it's great when you get to call on your old friends and buddies to come do stuff. And in fact, speaking of that, we have Risant Health also featured. So for those of you that aren't familiar, Risant was sort of the marriage of Kaiser and Geisinger, now with Cone added in there. So some three very successful groups in high value care. And we have the CMIO from Geisinger, Ben Homuth, who's probably one of the smartest guys I know.
Dartmouth grad?
No,
Okay.
he's more, Michigan guy.
Understood.
But I don't hold that against him. He's
Nope.
Wolverine. But he's got an MD, he's got an MPH, and he's Chief Medical Information Officer of one of the highest value health systems in the country. So he's going to tell us how Risant brings that value to Geisinger, and they can use that core experience that they've had over decades, while Geisinger brings this experience of working outside of a closed system to Kaiser. And so that's really accelerated high value care for that system.
That's great. That's a good agenda. What else do you have?
What else do we have? Well, we've got our AMGA consulting team.
Oh, do you really?
Yeah, we've got a couple of stars from
Of
there.
course. Yeah.
So we've got Mike Coppola, and we've got Fred Horton, who, despite being a Kansas City Chiefs fan, is still
really?
a great guy and really understands the consulting world.
Do you want to talk about the Eagles right now?
I do want to talk about the
Bird
Eagles.
Fly, what do you guys say?
I really do. Yeah, fly Eagles fly.
Fly Eagles fly. Sorry,
Yeah.
I missed it out.
EAGLES. Eagles.
Oh, that's
Spelling
okay.
spelling
I-
time.
Yeah.
Thank
I'm
you.
tired. It's been a minute.
That's the Steelers fan for you. Everything.
Steelers fan. So it's nice to see those guys know how to actually.
Yeah, so despite being a KC Chiefs fan, he's actually really knowledgeable about things like investment per physician and aligning your physician enterprise with high value care. So they're going to be giving that summary for everybody and sharing their insights of their latest white paper on investment per physician and how you can lower that and really drive your value-based contracts.
Which is one of the huge issues between health systems and group practices, is that intersection between those two groups and how they actually operate together. So that'll be a fantastic agenda. And you're right, Fred and Mike are two of the best in the business. So that's a great get for you, John.
Yeah, and then we get to wrap up with two of our stars, Daryl and Lauren, are going to be giving us
Oh my.
Yeah.
Yeah. I'm blushing.
AMGA's value agenda, DC update. So you want to talk a little bit about what's in store for that?
Yeah, no, it's one of those things where we'll pull it together about 10 minutes before we go on stage because things
That sounds about
things
right.
Well, everything changes in DC.
Everything
so quickly,
changes
why
so
not?
quickly,
Yeah.
but I think what it is, like, to build on what Tom was saying, we've got such a good story to tell. Like, you talk about these members who are coming in with these amazing things they're doing, and how that translates into policy, and how that policy gets drafted and then pushed back, and our members need to learn from that. So I think Laura and I and the rest of the team are sort of the intersection between the two. So we'll let you know if you come to the summit. Here's what we're hearing from the Hill. Here's what we're hearing from the new team over at CMS and HHS, and what that means for you and the provider community. And then we're going to transition and take that message and those stories from our members and take that to the Hill. So
Yeah.
it's pretty.
I'm going to focus a lot on time. I've actually been thinking about this presentation a lot. And times, they are changing. We live in interesting times, and time is moving swiftly. And what does that mean in reflection of how policies are being enacted, what's happening in administration, and like how can you best use your time to make an impact?
Fabulous. And so that'll be a good presentation, and that'll end the value roundtable. Is that
Yeah.
right, John?
I mean, there's one more area that I'd like to feature, and that's on ambulatory palliative care. The foundation has been really fortunate to receive a large grant, actually the largest ever in our history, to study ambulatory palliative care. So we're going to be kicking off this collaborative with a panel discussion, and we've got great speakers from Innova and Advocate, and the Innova speaker is a specialist in palliative care. And the Advocate is going to be talking about from a health system perspective. So whether you're in an independent group practice, whether you're in a health system, there'll be something for everybody at this meeting.
This is great. This is great. And Mike just put the microphone in my face. Thank you, Mike. And this is outstanding. And this happens right before Capitol Hill Day. So you would like your Value Roundtable folks to stay for Capitol Hill Day?
Absolutely. Yeah, we have a number of people, already a couple dozen people that are coming to both Capitol Hill Day and our Value Roundtable Summit. And we'll meet everybody at the Dubliner and celebrate in between the two events.
Is it too late to register, John, for this?
Oh, not at all. No. All you have to
good.
do, just go to amga.org and you'll find registration links for both the Value Roundtable Summit and Capitol Hill Day.
Great.
Okay. I think we're all sold. John, thank you so much. That was an outstanding description of the roundtable. It sounds like a great agenda. And as we mentioned, right after that is Capitol Hill Day. So team, let's talk about some Capitol Hill Day stuff. Let's talk about some of our past performances, the good, the bad, and the funny.
Well, let's talk about it.
Let's talk about it.
Yeah. So our Capitol Hill Day is going to take place. What day, J-Mail? What day are we taking place?
Okay, so let's go through the dates of the week. So Monday, June 9th, the Value folks will get in town. And then Tuesday, June 10th, the Value Roundtable will happen. And then there'll be a reception Tuesday night, June 10th. And then June 11th, we will have everybody to Capitol Hill. We'll walk you around. We can talk more about that, but that's Capitol Hill Day. And then on Wednesday night, when you get done, we're happy to meet you at the Irish pub to talk about any kind of follow up you like for us to do. But it's and then the board meets the next day. But I would say it's important. If you want to, you can come on Monday night and stay till Wednesday night and fly back.
A lot of Irish pubs will be part of this week
Yeah.
in Capitol Hill.
And it's right
Whole
near
week is
the
built around that, pretty much.
and for your Capitol Hill Day walking, it's right near the Senate, right near Union Station. It's called the Phoenix Park Hotel, which is 520 North Capitol Street. It's probably, I would say, a 5-minute walk to the Senate, about 10-15 minute to the
Depends on your shoes.
house on your shoes. And that's a good point. We got to advise people when you do come, bring comfortable shoes. I wear Allbirds and I get judged for it often. But
From me.
from Laura, but be comfortable because all these floors are marble.
Yeah.
Yeah.
Indeed, comfortable shoes are important. Actually, I had to do some EMT work on one of our members who had a pop blister on her heel.
Oh,
So
Oh, yeah.
in a Senate office, I got down on my knees and actually bandaged her up.
Wow.
So comfortable shoes is a good idea.
Yeah.
full service.
That is full service.
Yeah.
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 I was caring for the caregivers.
Help you with your risk adjustment,
Yeah.
everything else, and then we're gonna bandage you up and send you on your way.
Yeah, I mean, that's why Capitol Hill Day is important, right? It is a spotlight on our organization. It's a spotlight on your work, and it gives you an opportunity to do what I call sometimes like a first date. When you're meeting with your congressional members and their staff, you get to introduce yourself, you get to talk about your issues, you get to try to build connections there. Sometimes this is the first step. I think about the 3 C's that are needed for advocacy, which is communication, consistency, and continuity, making sure that you're continuing to build these relationships over time. Capitol Hill Day is a really great way, especially if you're a new member, especially if you have never been to DC or haven't done this type of programming before. It's really fun. We try to make it as easy as possible, and you get to be in the room where it happens. You get to see how Congress operates.
And to give more details on why we make this how this is so easy for you, you register on the website. Then we eventually send you, we set you up on we have a webinar a few weeks before the meeting, and we talk to you about what issue areas we're going to be talking about. And you can also talk about whatever issue areas you want to talk about. But also what makes it a lot easier is that all you do is you tell us you want to come, and then Lauren and I and other folks, Alicia, we set up your meetings for you. You don't have to do anything, and we'll schedule everything because we've all worked on the Hill. We know which meetings to go to, and then the day of the meeting, June 11th morning, 7:30 or 8 a.m., all of us will be at breakfast and briefing you on the lobbying to-dos and
To don'ts.
To-don'ts, yeah.
And so we make this as easy as possible. And if you need assistance, especially if you're new or you're all by yourself, we're happy to walk with you. That's part of our job. We're happy to provide that level of service. So, because it makes us, you being here, you seeing patients, it makes a larger impact than just us going and talking to them, saying the same thing over and over again.
Yeah, I think, Jamie mentioned if you're new to this, I think a lot of folks can get really intimidated. You show up in DC and you're walking to the Hill and you see like the Capitol Dome, and it's inspiring if you haven't seen it. You're like, part of our job, I think, walking around, I like to play tour guide a little bit, like, hey, it's the Supreme Court, that's the Library of Congress. Did you look at this, and people love that. But if you haven't done this before, I can appreciate how you can have some nerves, and you can be intimidating because you're walking into this member's office and there's a staffer over there, and you're not sure what to expect. So I think the first thing to recognize and to appreciate is more about these issues than probably 99% of the people on the Hill, right? You're going to be the expert in the room, and if you can leave have that good first date, like Lauren said, and have them want to call you back, that's a win.
Yeah, we've seen with our members who have done just an amazing job as being advocates. They have staffers, phone numbers, they reach out to them, people know who they are by name, and that doesn't happen overnight. A lot of people are afraid of, like, I would like to make an impact. Impact is something that happens over time. It does not happen immediately. And so we want to give you as many opportunities to make that impact as possible.
And we'll offer up training situations where we can help you with your elevator pitch and other things to make all your points as succinct as possible, because sometimes these meetings last 30 minutes, sometimes they last 4 minutes.
Sometimes they happen in a hallway.
Watch West Wing at the walk and talk.
Yeah, sometimes they happen in a random cubby hole someplace. Sometimes they happen as you're walking with the member as they go vote. I mean, it's like choose your own adventure when you go into these meetings. Sometimes it can be very interesting.
Yeah. And sometimes you meet in the Capitol. So it just depends.
Yeah.
You get that
yes.
bean soup.
Yeah.
The
Good
bean soup, yeah. And sometimes people ask, why should I do this? And one of our responses has always been, when you think about your revenue streams, over half come from the federal government. So it seems to make sense to us, at least, that knowing the people that control the purse strings, and that's your individual member of Congress and delegation, is important for you to advocate for yourself and educate them on the importance of Medicare, Medicaid, telehealth, value, whatever the cases may be. So, and speaking as a former Hill staffer, there's 3 of us here. People in the district helped us do our jobs better and helped us know our jobs better. And every Hill staffer wants to be really well informed. And so when you partner with them and do that, they will come to your assistance when you need it. That's what I did when I was on the Hill. So did Lauren, so did Jamie. So
Yeah, I relied heavily on our hospitals that were in our district and actually a little bit outside our district. One of them, Wellstar, is one of our members
Mhm.
here. I took a tour of one of their ambulatory care centers, and they also did like their sleep training studies there. And then I also did, this is not one of our members, but I did an overnight at Grady Hospital. I got to go into the emergency, I got to go into the operating room twice. I got to wear scrubs. I mean, like
Big
these are,
system.
it's a huge system. It's a lot of fun. I knew who I could talk to and I knew who I could trust based on just how often people came into the office. And so anytime you have an opportunity to share information with them, whether it's presenting some sort of presentation that you have, anything like that, the goal is to continue to build relationships on that day and after.
Okay. Well, it's fantastic. I hope you sold it. I think we did.
We hope you come.
Yeah,
Please
yeah,
sign
yeah,
up.
yeah.
Come
Please
hang out
come.
with us.
Yeah, and we'll come with you to the meetings. So
Yeah.
you're
We'll
never
have
alone.
umbrellas if it rains.
Yeah. Well, it is DC. It's June, so it'll be hot and possibly raining.
And we'll take pictures of you at the best, most flattering
Mhm.
angle. That's also important.
And that certainly is at the full service AMGA
Full service.
staffer.
Full
Yeah.
Service, yeah.
All right. Well, thank you. We want to thank our very special guest, Dr. John
Yay.
Kennedy, for talking about the Value Roundtable.
Well, thank you for inviting me.
It is our pleasure. And that's it. So we hope you all have a very good day. And we'll hopefully see you in DC in the second week of June.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.